Hello, I am George O. from the University of British Columbia, Department of Medicine and Division of Gastroenterology at St. Paul's Hospital in Vancouver, Canada. On behalf of all the authors, I would like to briefly talk to you about our recently published study titled The Effect of Chewing Gum on Small Bowel Transit Time in Capsule Endoscopy, a Prospective Randomized Trial. Capsule endoscopy is a great way to assess the small bowel non-invasively. It has both high sensitivity and specificity for many conditions. But an important limitation of this technology is the limited battery life, which means the capsule camera may run out of battery before it has a chance to examine the entire length of the small bowel. This happens in approximately 15 to 20% of the time and has important implications for both clinical outcome as well as resource utilization, particularly when the investigations have to be repeated to evaluate the distal portion that was not visualized. As the capsule camera has no means of propelling itself forward, it relies primarily on gut peristalsis for transit. Many studies have looked at using various prokinetics or purgatives to increase the completion rate, but so far the results have been mixed, which is why there is currently no recommendations for the routine use of any of these methods. As capsule endoscopy is done mostly on an outpatient basis, we wanted to explore simpler and more convenient methods to enhance bowel motility. For this reason, we looked to our surgical colleagues for ideas and came across the chewing gum. There is promising evidence that chewing gum reduces the duration of postoperative ileus by emulating sham feeding and inducing bowel motility. Two previous studies demonstrated that chewing gum reduced the small bowel transit time and increased capsule completion rate, but only one study was randomized and had a smaller sample size. As a result, we conducted an endoscopist-blinded, randomized control trial to ascertain whether chewing gum has any effect on the capsule transit and completion rate. The capsule endoscopy system we used was PillCam SB2 by given imaging, with battery life limited to just under 8 hours. We asked the subjects randomized to the treatment group to chew a piece of gum for at least 20 minutes every 2 hours, starting immediately after capsule camera ingestion. All subjects were allowed to drink clear liquid after 2 hours and to resume regular diet after 4 hours, as per our usual practice. As you will read in our paper, although chewing gum is effective in the surgical field at reducing the duration of post-op ileus, it did not affect capsule transit time or the rate at which it reaches the cecum. In our study, the control group and the chewing gum group achieved completion rates of 89 and 92% respectively, both of which are higher than the 83.5% average rate quoted in the previous meta-analysis. Of note is that the population we studied is relatively healthy and without risk factors for incomplete capsule studies. It is possible that their healthy status may explain their high baseline completion rates. At this time, it is not entirely clear whether there is a role for chewing gum in patients at risk of slower bowel motility, such as hospitalized patients, those with altered bowel anatomy, those with complicated diabetes, and those taking narcotics. It is possible that sham feeding's effect only becomes more apparent when there is impaired bowel motility, as in the case of post-op state. Further studies would be required to investigate this. However, as the technology continues to advance with newer generation capsule camera, the image quality improves, as does the battery life. For example, our experience with the newer PillCam capsules has shown a nearly one-fold increase in the maximum operation time, up to 14 hours. With the longer battery life, we anticipate the capsule endoscopy completion rate to increase and further reduce the need for motility-enhancing agents. This will have to be verified in future studies. In summary, our study does not support the routine use of chewing gum in relatively healthy patients for outpatient capsule endoscopy. It is likely that the issue of incomplete capsule studies will diminish as the battery life of the camera improves, enabling complete visualization of the small bowel, even in those with slower motility. I hope you find our paper useful, and thank you for watching this video.